Hi, folks. Today is Friday, October 2nd, and I just want to start. We have some actual facts and results and things of that nature to talk to you about, but one of my teammates here said to me the other day, we've now been through all 4 seasons in a COVID world. This started in March when we were still in winter, been through spring and summer fully, and now we're into fall. You can see from my vest, I'm into fall. And that's crazy, right? I mean, 4 seasons of COVID, and it's draining. I think I just want to acknowledge that. I don't know what to do about it, but it's draining for our staff. Some weeks just feel like such a drag. It's draining for our staff. It's draining for you, our residents, and it's draining for your families too, because everything is different. We want to be together. We want life to go back to the way it was, or at least more like the way it was. And we have all of these risk factors to take into account whenever we're making decisions. And it sucks. And I think we all need to acknowledge that every now and then. But yesterday I had lunch with one of my favorite people. I had a cheeseburger at the park, on a picnic table. And what it reminded me was there's still so much good that can happen. There are certain things we can't do, but there's so many things we can do, and that we couldn't maybe do in March or April or May. And so just a reminder that we're here, we're in this together, and I really appreciate the connection between our residents, our staff. I hear from many resident families, this is a challenge, but being in it together makes everything a little easier. So enough of that. Move on to some testing results. The last time I made a video, I think we had just gotten back initial results and had from the RiverWoods Exeter campus, we had a healthcare staff member test positive, which set us off on multiple rounds of testing here in Exeter. Our healthcare staff and our healthcare residents have been tested at least twice and generally 3 times in the course of the last 2 weeks. And through all of that testing, we identified 2 healthcare residents at our Woods campus and 1 healthcare resident at our Ridge campus who tested positive. No other staff members tested positive. The Ridge healthcare resident has now tested negative twice, so I think there's a chance that may have been an initial false positive. And the other 2 healthcare residents neither show any significant signs or showed any significant signs of symptoms of the disease. So that's good. This seems to be a very contained issue. And we continue to test. The Woods campus will, again, get National Guard testing next Monday. And the Ridge and the Boulders have been cleared from outbreak status. Our Birch Hill community also participates in the state surveillance testing. They got their last few results from the most recent round of testing yesterday, and those were all negative. And our RiverWoods Durham campus, because it's in Stratford County, it's not allowed in the state testing, but what we've done is just mirror that program, and we do that testing through a commercial lab, and those results were all negative. So that's good. We'll talk a little bit about testing in the future. The state's program through the surveillance testing, if you have no positive cases, the state provides the test, the courier, the lab for free. They are changing that middle to the end of this month, so that a community or facility picks its own lab, and the state provides a set amount of money and for a set amount of tests. I want you to know that won't be an issue. If you hear that on the news, that the state is changing its program, we already have our commercial lab lined up, and that will be 24 to 36 hour result testing. So we're kind of excited about that, because the faster you know, the better. Additionally, in terms of passive testing, we have just completed our first round of wastewater testing, and we're working with a PhD scientist professor from University of New Hampshire. And our results are, we did our first round of sort of baseline testing. And what I understand from this, though I am not a scientist, is that essentially this is science in progress. They are figuring out how much virus is shed in waste and how to predict what the impacts are. So essentially, since there's no sort of black and white yes and no or number associated, you look at trends, and they can tell us if you get above a certain number of particles per thousand, then it's very likely that you have some active cases. So good news is we're nowhere near that, and what we'll do is test the poop twice a week going forward, and what we'll do is look for trends, and if anything sort of alights, we will do more intensive individual testing. Additionally, on testing, we now have through the course of the communities, Exeter, Durham, and Bertil, we have 4 rapid test machines, BD Veritor rapid test machines. We're waiting on a bunch of test kits, but we have the machines. And these test machines are highly accurate for folks with symptoms. So that's good news because we're entering into cold and flu season. Many of those symptoms are similar to COVID-19 symptoms. So we will use those for residents or staff who may have symptoms and concerns. Additionally, there's a testing option called Biax now. That is something, it's like a card that's made by Abbott, and it is also a rapid test, a 15-minute test. They're not commercially available yet, but we expect those for November, December, by the end of the year. And that's a very cheap test. That's $5. So we're kind of excited about that because the ability to have really inexpensive and rapid tests allows us to do some more things with less risk. So we want to talk about just 2 other things. One is, we know many of you are anxious to kind of open things up more, live a little bit more of a full life, and that includes visitors on our campus and dining in our dining rooms. And what I would say to you is coming, but not yet. Visitors, no time frame for that. That is just that's a risk. That's people outside our campus coming in that we're not ready to accept yet. And we probably need like that Biax now testing to be able to allow that. Dining, we're making plans, but not for next week. Think November, we're going to put it off as long as we can because we're a pretty risk-averse population and because you can't eat with a mask on. So those are risks that we don't need to take right now, and so we won't. But to end on a sort of a positive note, the state is already making plans for vaccine distribution, which is good news. We don't know when. I don't think, and none of us know when, but it's not a year away. It's months away, and we'll get there. I read an article, and I want to make sure that vaccine is safe for you, safe for our staff. But as soon as it is, we want to get it. And the good news there is that healthcare workers and the senior population will be in the first group of people to be able to access the vaccine. And I read an article last night that talked about a letter that the CEO of Pfizer Chemical, who has a vaccine in this phase 3 trials, he wrote to his entire employee population expressing some sorrow that the vaccine process has been politicized a bit, and reassuring his team that they will operate at the speed of science. And I thought that was an absolutely fantastic term because it feels like that's what we've been trying to do for the last 7 months. operate at the speed of science, make decisions that are objective, make decisions that are backed by what science is telling us is risky or not, and make decisions with your best interests and our staff team's best interest at heart. So that's what we'll continue to do. I will be back with you again soon, hopefully not too soon, because sometimes I'm back with bad news, but today it feels like sort of a not such bad news. The seasons are changing. We're all a little sick of this, but we are in this together. And I am heartened to see the connections between our staff, between our residents and staff, and our residents' families. I hear from many of our residents' families just with some comfort and some questions, but also with some real appreciation for what our communities are, what our family of communities is. So with that, I would say wash your hands and stay healthy, my friends.